Hi everyone, I hope you're all staying safe and making the most of your time at home. I would hope that you know who I am at this point, but if you don't, my name is Morgan Kester, and today I will be talking about determining the causative effect of butyrate produced by Copracoccus species on depression in mice. Now, I'd like to start off by talking a little bit about depression because it is such a dire issue not only in the US but in the world. Nearly 264 million people suffer from depression worldwide, with 800,000 deaths per year as a result of suicide. It is now the leading cause of death for people aged 15 to 29 years, and the rates have been increasing in recent years. The suicide rate in the US is currently at its highest point since World War II, and it's becoming even more important with recent events concerning coronavirus. People are isolated at home, they're losing their jobs, they're losing their family, and suicide hotlines are now reporting an 800% increase in calls since the beginning of the pandemic. Now, there are some possible explanations for this. One of the possible contributors is the association between income inequality and suicide rate in the United States. Obviously, correlation does not prove causation. However, there is a very strong correlation between these two factors. It may seem like it would be very easy to get to treatment for depression, specifically because there are so many antidepressants on the market. However, there are some very debilitating side effects to antidepressants. SSRIs, which are the most commonly used, have the side effects of insomnia, skin rashes, headaches, joint and muscle pain, the list goes on. And they can even lose effectiveness over time. And if you decide to stop taking them, even that can give you side effects. And many people decide not to get treated at all. 76 to 85% of people in low and middle income areas receive no treatment whatsoever for their depression. And that can either be because of a lack of resources, because it can be very expensive to buy SSRIs every month. But there is also a major social stigma with depression. There are many, many people who suffer from depression that don't want to admit it, and they avoid seeking treatment because they're embarrassed. Now, even though there are possible external contributors to depression, there is increasing evidence that there is a major physiological component to the disorder. There are at least 1,000 known bacterial species in the gut microbiome and more than 3 million genes. And each of those species produces their own unique cocktail of chemical compounds that are then absorbed by the intestinal wall. And just like the food that is absorbed through your gut, it's not that far of a stretch to think, hey, maybe these chemical compounds are having an effect on our body and on our brain. In fact, recent studies have shown a negative correlation between bacteria of the genus Copracoccus and major depressive disorder. And what we want to know is why. Now, why butyrate? Butyrate is a short-chain fatty acid that is produced by certain bacteria in your gut as they ferment dietary fibers. And these bacteria that produce butyrate have been linked to depression, as well as non-butyrogenic bacteria that aid butyrate production in butyrate-producing species. And those are also decreased in depressed individuals. Now, again, why are we looking at butyrate specifically instead of another compound produced by these bacteria? First of all, butyrate has anti-inflammatory properties, and it has been associated with many disorders that have an inflammatory component. And those include allergies, asthma, Parkinson's disease, Alzheimer's disease, bipolar disorder, and a whole handful of other diseases and disorders. And sadly, even though the link between butyrate and depression has been understudied, there is a major link between inflammation and depression, which leads me to my hypothesis. I hypothesize that if butyrate production by Coprococcus species is ceased in mice, the incidence of depressive behaviors will increase. As far as my specific aims, my first aim is to develop a non-butyrogenic mutant of Coprococcus comes and Coprococcus eutactus and compare their effects on mice to their wild-type counterparts. My second aim is to quantify the presence and severity of depression in mice that have been inoculated with these wild-type Coprococcus species and their non-butyrogenic mutant counterparts using shock avoidance testing. My third aim will be to develop a causative negative relationship between the production of butyrate by Coprococcus species and depression in mice. Now I'm sure you're wondering, how the heck do you test for depression in mice? Do mice even get depression? You might be surprised to find out that the answer is yes. In fact, many studies have used mice as an animal model for testing symptoms of depression. And that's mostly because studies involving depression in humans are very difficult to do because of confounding variables related to medication history, diet. It is very difficult to do depression studies on humans. Many of the studies that use animal models for depression focus on symptoms like hopelessness, despair, and anhedonia. And that just means that there's a loss of interest in things that were once pleasurable, which is a very common symptom of depression. The studies that have focused on the symptoms of hopelessness and despair typically do so by introducing a negative stimulus, and then they give the subject the ability to escape. Now, depressed mice usually will have a delayed escape time, or they don't attempt to escape at all. And examples of this are the forced swim test, the tail suspension test, and shock avoidance. This study plans to use the shock avoidance test, which I will go into more detail about later. Now, of course, the challenging part of this is how do we do it? So what we plan to do is to induce mutations that would interrupt the metabolic pathway for butyrate production. And we would do so by first inoculating 60 plates of trypticase soy agar that has been enriched with defibrinated sheep blood. Defibrinated basically just means that the protein fibrin has been removed from the blood, which is one of the major components that helps it clot. We would then expose those plates to either UV or X-rays just to ensure that we're using the most effective mutagen to induce the mutation that we're looking for. The plates would then be incubated overnight and evaluated for mutations. Now, this is the overall most challenging part of the entire experiment because this has never been done before for butyrate production. We could possibly test the metabolites from each specific colony that we've produced using mass spectrometry. However, this is very time consuming and it may not be viable for the study. Alternatives could be the use of fluorescence to monitor enzymatic activity, protein-protein interactions, or ligand-binding proteins. However, like I said, because this has not been done before, there would be a lot of experimentation necessary in order to determine viable methods to produce these non-butyrogenic mutants. We would then need to essentially prime the gut of our mouse test subjects. We would do this by first reducing the wild type Coprococcus species as much as possible in the gut. And we would use equal numbers of male and female mice, 60 total, and administer an antibiotic to target only gram-positive bacteria. We would also need to control for the altered microbiome following antibiotic treatment, because this isn't just going to affect the Coprococcus species, obviously. It's going to reduce almost all of the species in the gut, all of the gram-positive species anyway. We would use qPCR to confirm that the 2 Coprococcus species are not present in the gut, and if they are, we would administer a second round of antibiotics and retest. In order to introduce back the either wild type or non-butyrogenic mutants, we would perform a fecal transplant using the mice's own feces, inoculated with either the mutant or wild type counterpart. And to control for the effect of the antibiotics on the microbiome, we may also inoculate feces with other bacteria, just depending on the effect of the antibiotics. And we would also use a control group of mice that would not have their microbiome altered in any way. So no treatment with antibiotics, no fecal transplant, none of that. And the final step would be to evaluate the depressive symptoms in the treated and control mice. And we would do so, as I said, with shock avoidance testing. Now, many of the studies that have used this method in the past have first presented mice with a shock that they can't escape at first. And they do so by putting an electrical grid in the floor of the enclosure. And then 24 hours later, mice would be placed in an escape chamber where they would be delivered a mild shock, which can be deactivated by crossing the chamber and then returning to the original side. Non-depressed mice will typically deactivate the shock within about 5 seconds, but if depressed, the escape time can range anywhere from 10 to 19 seconds. And a mouse with severe depression can take up to 30 seconds to escape the shock. So we would measure escape times, and then we would compare escape times for our different testing groups using an unpaired t-test. And what we would expect to see would be that the mice that were inoculated with the mutant non-butyrogenic bacteria would have increased escape times, suggesting that they would be more depressed. And here are my references. I hope you are all having a wonderful rest of your semester and a wonderful evening.